It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi folks, thanks for joining us. I'm Sam Lesante. You know, we talk about the healthcare in Greater Hazleton area with the Greater Hazleton Health Alliance, and as you know, we have a number of doctors coming into our area, and we're very excited about them coming into our area, especially bringing some new ideas and innovative, creative things that they want to do as far as healthcare is concerned. Today, I'm very happy to have on the show Dr. Haitham Shahrour, and he is a pediatrician. He's located up there at Pediatrics Associates of Hazleton, right next to the Wellness Center. And we'll have the number on the screen for you because I know you'd like to call and ask some questions about the show. 501-6400. And Dr. Shahrour, how are you?
Good, how are you?
I'm doing fine. Nice to meet you.
Nice to meet you too.
So you're from Syria, right?
Yes, I am.
Okay, and how are things in Syria? You have family there, right?
Yeah, I have a family there, and so far they've been good.
That's good. Your experience. Now, first of all, you tell us a little bit about yourself, so people watching and showing who is this handsome guy, Dr. Shahrour.
Thank you. Well, I was born and raised in Damascus, Syria. It's a small country in the Middle East, and I did my medical school in Faculty of Medicine, Damascus University. I graduated in 2007, and then I moved to United States, and I did my pediatric training at the Women and Children's Hospital of Buffalo. It's an affiliated hospital with State University of New York at Buffalo, and it's a tertiary center of Western New York.
So, looking at the Greater Hazleton area, what attracted you to come down to this area?
Mainly the location, especially that it's close to New York City, which I like to visit, not to live there, but so it worked out really well, yeah, for me.
Have fun there and visit, but you know, some people wouldn't like to live there. Okay?
Yeah.
But it's a beautiful area.
Yeah,
okay?
it is.
And you've been here for 3 months so far.
Yeah.
Okay. And now you have some, you're specializing in different areas, okay? And one of the areas which I find very interesting, and we have a lot of it in this region, is asthma, okay? How would you describe, what is the definition, okay, of asthma?
Okay. I'm going to try to use simple words.
Yeah, please, because I'm not that smart.
Okay. So basically it's a chronic inflammatory disease of the lungs. And what happens, swelling and narrowing or obstructions of the airways. And this happens usually as a result of interaction between environmental factors and genetic factors. And this would lead to certain symptoms like coughing, wheezing, shortness of breath, chest tightness, and the rest of asthma symptoms.
Now, is this hereditary? Do people develop it, or what?
Well,
I mean, you mentioned some of the common symptoms. What are any additional symptoms? I mean,
yeah, asthma basically, as I mentioned, cough, wheezing, shortness of breath, and especially this happens sometimes with exercising if they have exercise-induced asthma or bronchospasm, nighttime cough. Those basically the main symptoms of asthma.
okay, so now, if you have some of these symptoms, I mentioned about hereditary. If your father or your mother or any of your family has asthma, is it possible that you would develop it as well, or is it just?
It's likely. It's not the rule. It's not necessary. But if there is a strong family history of asthma, it's more likely that the children would have asthma or some degree of what we call reactive airway disease.
Well, pediatrics, okay? I mean, you're dealing with children, okay? How's a child? I mean, what are some of the areas, the things that a child would develop asthma?
Oh, what do you mean?
I mean, young children, okay? in developing asthma? Are there areas, I mean, some symptoms or areas that they should not be around, like smoke-filled homes?
Yeah.
I mean, I'm just trying to bring up,
Yeah.
raising my child.
Actually, avoidance triggering factors is an important part of asthma management, and especially allergens, smoking. Some kids would be allergic to dogs and cats, and I've seen a lot of uncontrolled asthma just because the children are around the triggering symptoms, the triggering factors.
So what do you say to these people? And I know this is always a controversial thing that I discuss, but I mean, we're looking for the health of a child. Have a baby's born.
Mm-hmm.
This baby has no control over their life other than what the parents or guardians do for this child.
Mm-hmm.
However, there are some people that feel they smoke in the home with the baby. They may bring animals in, not realizing, if they're allergic. But particularly with smoke, they're in the car with the child in the back, and there they are puffing away and all this smoke. Okay, is this a good thing? Is it a bad thing, or should we be concerned about it? I mean, am I making a big thing about this, or what?
Definitely, smoking is a bad thing for asthmatics, and just smoking could be a main reason for us not to be able to take control of asthma symptoms. Whatever the medication we prescribe for the patient, if they are not avoiding the triggers, we're not going to be able to control their symptoms. So it's very important to avoid smoking and other triggers factors.
Okay, now, what is the importance of keeping track of these symptoms? Okay, we know that you should not smoke around children, okay, particularly babies, okay. Why people do this, I have no idea. And especially when people come over and visit, they have one room in the house, they smoke, but realizing the smoke is still there and the child is breathing this, okay. It's like feeding a little bit of poison to your child every day. Would you do that to your child? They'd say no, but yet they'll smoke a cigarette and don't care about the child.
That's a true statement.
And I know people get upset when I say that, but it's a fact, okay? You're a doctor and you're attesting to that, okay? The importance of keeping track of asthma symptoms.
Well, when I say keep track of asthma symptoms, what I mean by that the family need to keep an eye on how often their child requiring albuterol or breathing treatment, how often they are having nighttime symptoms, how often they have asthma attacks, how often they get hospitalized, because all of these factors can help us to classify the asthma severity, and based on that we decide what medication that they need. So I always tell the family when they come to the clinic for an asthma evaluation, you need to keep track of their symptoms, and this would help me and guide me to what exactly I need prescribed for this child.
When are the dangerous signs of respiratory distress secondary to asthma attack?
Those I also discuss with the parents the signs and or the danger signs of asthma attacks, and what I'm trying to say, when the family should be worried when their child has an asthma attack. And basically, if they are breathing, it's kind of common sense signs when they are breathing fast, when they look at their chest, and when they see the space between the ribs kind of sucking inside. This means that their child is having trouble breathing, and they need to take their child to the closest emergency room. Or change in the color of the face, obviously, or if they are not able to say full sentences, this is also an important danger sign that they need to watch out for.
Now, what causes asthma in young people? I mean, I know the older people, some worked in the mines, some, you know, with the work related, but I mean, you see young kids who have asthma. I mean, we talked about smoking, et cetera, but I mean, is there any preventative things other than keeping your house, you know, clean as air purifiers or whatever?
Well, when it comes to asthma, genetics could play an important role, plus the environment. So it's kind of interaction between both genetics and environment. And there are a lot of triggering factors like cold, viral illnesses, weather change, smoking, and there are a long list of asthma attack triggering factors.
So when I take my child in for their examination, okay, whether it's a yearly exam or whatever, okay, do you do a test as to whether the child may have asthma or?
Yeah, definitely. It depends on the child's age, and basically detailed history and thorough physical exam are the key in most cases. And there are some other tests that we can do for children older than 6 years, what we call pulmonary function test. And this would give us an idea about the lungs capacity. And there are certain numbers that we look at, and this would sometimes help us to make the diagnosis.
So now you do have medications, okay? So there's the rescue medication and there's a maintenance medication, okay? Excuse me. What's the difference between rescue medication versus maintenance medications?
Oh, thank you. I'm kind of glad that you asked me this question because from my experience, I've noticed that a lot of people don't understand what the differences between the rescue medication and the maintenance medication. Basically, the rescue medication, it's mainly albuterol. And this medication, the family have to give to their child on as-needed basis. And this means when they are having asthma symptoms. One of the symptoms that I mentioned before is if the child have one of those symptoms, this means that they need albuterol. And they need to make sure to administer this medication with appropriate equipment. This is very important too. So if they have the inhaler pump, they need to use it with the spacer because this maximize the delivery of the medication to the lungs. On the other hand, the maintenance medication is what we call the preventive medicine, and this medicine basically prevent getting asthma attacks, and those basically the medication that they have to take on daily basis, like Pulmicort, Flovent, and there are a long list of these medication. So those medication they have to take regardless if they have symptoms or not, and they can be weaned off these medication based on their response and based on asthma control overall.
Are there any factors contributing to asthma, such as whether weight factor, if a child is, obese or weight or exercise, if they play heavy sports or whatever?
Well, obesity itself can compromise pulmonary or lung functions. So there is no clear correlation between them, but obesity with asthma can be a bad combination.
So I guess a parent was saying, well, how do I prevent my child from getting asthma? Okay, or what are some of the we know cleaning, not smoking and keeping allergics out of them, but whether the child is overweight, whether I don't know. I mean,
basically, medication compliance. This is very important, and if they are allergic to anything, they should avoid that. And here it comes the importance sometimes of doing skin testing to find out what they are allergic to. And basically those what I can think of.
Okay. Folks, if you just tuned in, I'm talking to Dr. Haitham Shahrour. And it's a welcome pleasure to have some great doctors coming into our area. The fact that they come here because of the area and they enjoy the environment, enjoy the camaraderie they have with a lot of friends. He is with the Pediatrics Associates of Hazleton, and it's 501-6400 if you have any information. And we're particularly zeroing in on asthma today. But how often should should your child come in for just a general physical exam?
Well, it depends on the age of the child, and it depends if they have any chronic illnesses or not. So, for example, usually for children younger than 1, they have to come to the office every 2 to 3 months. And then from 1 to 2 every 3 months, and then after that every year.
I want to ask you, why did you decide to become a pediatrician?
Well, that's a good question. Thank you for asking this. To me, it's basically very rewarding to see a smile on a child's face after you help him. And I like to be around children. I like to help them, especially those who don't have enough support. So,
well, that's good. You're dedicated to what you're doing, and you love it. That's great. The importance of correct use of asthma equipment, like the spacers, the face masks.
Yeah, this is very important because I've noticed a lot of family administer the breathing treatment the wrong way, and most of the time they don't use the spacer, which is basically the air chamber that maximizes the delivery of the medication to the lungs. Without using the spacer, what they do usually, they throw the medication inside the mouth and it would not get into the lungs. The other thing is what we call the peri-LC mask, which is like a face mask, and this also maximizes the delivery of the maintenance medication we talked about, especially Pulmicort. So this is very important.
Are there any exercises for lungs?
Yeah, usually it's especially there is something called spirometry, and basically what they have to do is just blow through this small piece, and this would help to improve lung capacity and to check the volume of their lungs, and this would kind of lead us if they are improving or not.
Okay, now here we may have touched on this, but the importance of avoidance triggering factors.
This, as I mentioned before, this is an important factor in controlling asthma, and sometimes we don't know what the child is allergic to, but in most cases we do, and if we can avoid these factors, we can get an excellent control of asthma.
So once again, for those people who maybe just tuned in, folks, you watch this ssptv.com or go to the Wellness Center. These are on YouTube. All these shows are very important to understand. Asthma, how would you describe, what's the definition of asthma?
Again, it's basically a chronic inflammatory disease of the lung, and obstruction of the airways that causes trouble breathing. And I have to say it's a reversible obstruction. It's not permanent obstruction. And by saying reversible obstruction, meaning if you give a certain medication, you would reverse this obstruction.
Of course, maintaining the fact that you're putting them in a good environment as well.
Exactly.
I mean, if they're in a smoke-filled home, you know, the kids don't have any chances. Particularly in what really gets me is when kids are in a car and they're smoking in the car as well. I mean, I know I'm anti-smoking, but people get upset with me. We're only talking about health for the kids. I mean, you see these poor kids, they have no control over their lives. They're doing what their parents and guardians are telling them to do. When you're an adult, if you're stupid enough to do what you have to do, like any drinking or drugs, etc., that's your fault. But a kid doesn't have a chance, okay?
Definitely, I agree.
Now, you are thinking, and I like creative thinkers, okay? It's a great thing about getting the new doctors into this area. They come up with a lot of great ideas, a lot of knowledge. As a pediatrician, you're thinking of developing an asthma clinic. Let's talk about this.
Yeah, actually, one of my main goals is to achieve or to provide better understanding and education of asthma in Hazleton community, and we are in the process of developing asthma clinic that provides an excellent care for asthma patients. So we are working on that now.
You're excited about that, aren't you?
I am.
Yeah. You know, when we, many years ago, doctor, in this area, and I'm talking many years ago, we always had the, some people felt that, you know, you had to always go out of town for, you know, good health, you know, care. And in the last number of years, you know, we've seen so many doctors come in with so much experience that it's interesting. So when you looked at this area, now you know, you're a young guy, you know, you have a lot of knowledge, you certainly seem to know your stuff. Why didn't you go to Philadelphia? Why didn't you go to Allentown? Why didn't you go to Harrisburg? Why didn't you go to one of the big cities? Why do you decide to come to Hazleton?
Because I felt that being a fresh graduate, and I feel that I have potential to provide an excellent care for underserved area. I thought that this would be really rewarding, and this is one of the reasons that made me come over here.
Now you're up there at the Pediatric Associates, okay, with my good friend Dr. Caggiano, and who is a great guy.
Dr. Glicken.
Yeah, and Dr. Glicken, Dr. Singh, and Jeff Kulza, who is the nurse practitioner up there. You have a great healthcare system here, and you're thinking of developing this asthma clinic, okay? For a review, okay, for someone who is looking, who doesn't understand all about asthma, they may feel either they or their children may have asthma because they're having some of the symptoms again are what, doctor?
Cough, wheezing, chest tightness, shortness of breath. Those basically are the main symptoms.
Now, now, of course, if your kid's starting to cough, I mean, you know, doesn't necessarily mean they have asthma, but you're looking at it if it's a constant thing.
Yes.
Okay. Now they have different sprays that they, you know, they put in their mouth. What does that do? Does that reduce the swelling, or what is it?
Yeah. So albuterol, which is one of the rescue medication, what it does basically relieve the airway narrowing or obstruction, and basically it's a smooth muscle relaxant, and this is what it does. On the other hand, the maintenance medication, what it does basically decrease the swelling and the inflammation and decrease the secretions inside the lungs.
That's what I was going to ask you. Inflammation is one of the key
Yeah.
problems here. So now I know I take omega-3s every day, you know, with the PRN brand, the fish oils, etc., which really help in you know, with inflammation. Now, is diet important for a person who's on asthma?
Probably if they are allergic to something in their diet, this would be an important thing to know, and avoiding this certain food is important in controlling their asthma. And again, to find out what they are allergic to, there are certain tests that we can do to find out. So diet is important too.
Yeah, I mean, if it's inflammation, I mean, like, I don't know, I'm sure they have fish oils for children, you know, are you familiar with the omega? I'm sure I'm asking stupid. You're familiar with the omega-3s, correct?
I am, but I'm not quite sure if it would help or not with asthma.
Because of inflammation, okay. When you're looking at taking care of your, you know, the health care of your child, and when particularly with asthma, all right, I would suggest that if there's any telltale signs that you think your child has that, okay, and what are the ages what are the most ages you're seeing that have asthma? I mean, I know it could be anyone, but if you had to have a bulk of ages, is it a certain age group?
Well, I mean, it depends on what they have. I mean, children could have wheezing at early age, sometimes at 1 month, and sometimes later on. But it's pretty common, somewhere between 3 and 6
Is that
year
right?
old. Yeah.
Well, folks, remember, it's so important to make sure you take care of course, your children. You wouldn't want to see no one hurt your child, but sometimes you're doing more damage to your children by smoking in the house, smoking in the car, and bringing things in that that do not help your children. Dr. Haitham Shahrour, not new guy to medicine, but new in this area, been here for 3 months, Pediatric Associates of Hazleton, doing a great job. We welcome you in the Greater Hazleton area.
Thank you very much.
We wish you the best success. You're with a great organization, the Greater Hazleton Health Alliance.
Thank you. I'm glad to be here.
And don't be a stranger to the Sam Lesante Show. Tell Melanie that you'd like to come on the show once in a while, okay?
All right.
All right. The number up there, folks, 501-6400. Go to their website, and you can check all of their doctors out. It's a very impressive website. Also, go to ssptv.com, and you can watch any of the Sam Lesante shows, as well as all the health shows we're doing to provide you health care information. No need, folks, to go out of town. Check the credentials of our doctors in this area. You'll be very surprised. We have a lot of great, great doctors in our area, and we're very proud of them. We'll see you next time.